Okay, so let's move on and see what we were able to glean about person X. So our first question, first of all, let's hear some of the names.
Write it up.
All right.
Let's people come up with race. Everybody except table 6.
Table 6 cheated.
Had a consultation, but that's all right. We'll get to
Thank you, Candace.
Right over here. Right over here. That's fine. That's all right. No.
This was not an interdisciplinary consultation.
No way.
All right. Who else named person X? Wow, that's very
Thomas Washington Jr. Marilyn. Chris.
Right. Another cheater.
So we have two James, right? We have Marilyn, Chris, Tim, Thomas, Benjamin. Now let's see if we can find out the race or ethnicity. Race being one, ethnicity second. Race is obviously the color of one's skin. Ethnicity is the country of origin in which one is born. Someone want to take a stab? Table 6, you're allowed to participate. I was only teasing. Yes?
Candace.
Okay.
Does anybody agree with Candace? A couple of hands.
Parts of it.
Not Caribbean.
Okay, black, not Caribbean. Other answers. Any other answers different from African American? Any ethnicity?
Any other?
Okay, so I want to know why we think, first of all, why is this person black or African American?
Black frat accused. His father is a Belay. His mom's a Link. These are all African American social clubs.
The reason why I picked black and not African American is because Belay is a Caribbean fraternity. And so that's why I put that he may be Caribbean because he may be from the islands. And so that's why I just put black and Caribbean.
So his parents could be from the Caribbean.
Yeah.
We don't know where he grew up necessarily, or she grew up. We haven't discussed gender or sexual identity quite yet.
Does everybody understand the social clubs? Okay. All right. We're going to come back to that. Okay.
Okay, what else can we infer about person X? So we got sexual identity. What was the sexual identity? Unknown.
It was not known. I just put the LGBTQ community.
Okay, LGBTQ community. Okay, that's a good answer. And what about gender? Biological gender? Do we know?
What is table 4 saying over there? Because I see they're correcting each other over there. What?
Strong affiliation does not mean member.
Right.
So it could be one.
It did say he joined. Oops. It said person X joined.
Yes, it said joy. It's a man and he's gay and doesn't want the
Okay, so the consensus is probably biological male. Maybe.
Maybe.
Maybe transgender.
Yeah, and you just don't know. And even though he joined the Qs, he could still be biologically a woman, but you don't know.
So probably identifies as a male.
Right.
Okay, what else did we learn? What are some of the social determinants that were affecting person X? Health of the father, coming out to the family, not coming out to anyone else.
The literacy around long-term care, like understanding, the nuances of long-term care, have health literacy, because they decline all of the medical help.
Okay.
Not have the literacy around.
Maybe not having literacy around healthcare and social services.
But that could also be a cultural
Exactly.
component where
Could be cultural.
family take care of their own and using.
Could be cultural. It could also be related to secrets and not willing to share personal trauma or problems.
Right, it's because based on the memberships, I think they're probably quite literal,
Yes.
but that there is a choice to not engage services for whatever the reasons may be.
Okay. And that brings us to another one. What about his or her class? Socioeconomic class.
Potentially upper, they may actually have sufficient wealth to be a part of the privilege.
Right.
We don't know that either.
Okay.
What about religion?
I say Christianity, but the knights threw me off, because it could be he may be a different, religion than his parents are, because the knights, because they have a lot of different ideologies than Christian based. So he may be Christian, and that's the reason why he may be having the conflicts with his father.
And it could be Knights of Columbus.
Yes.
Right.
Yes.
Which is Catholic, right?
Right.
I think he's spiritual, but I don't know what religion they're in. But the family seems to have the interest in joining and being a part of different groups, but really private about things that are viewed within the house. So I think that's the reason they don't want to bring anybody.
Mics.
If the tables could leave an open mic on, please.
Okay, one open
Think that-
mic at each table, please.
So if you also look at this from what we heard Ruth say the other day and go back to some of her slides and just kind of think of that, kind of think of it from an intersectionality part as well. What are some of those things that occur when people come out, right? What are the secrets that families have? How does it relate to all of those social organizations that one belongs to? What are the taboo areas that might be hot buttons for that family? Because often we look at people only as their race and all of these other issues, but we don't get under the surface of what happens to an 18 or 19-year-older that comes out in college, and goes home and tells their family. And then is it or does it become a family secret? And then how does that family secret relate to the class issues, right? This is a young person who is supposed to go off to college to become, like you, a medical doctor, and all of a sudden his father struggling with some medical issues. And what do we know about people of color as it relates to coming to receive mental health services?
It's a stigma. It's
Okay.
We always in the community, you go to a spiritual counselor and not an actual counselor, because then you're crazy. Aunt Jane in the back, we put her in the back room and we know, something's wrong with her, but she's not going to see a quack, as they used to say in the old days. But the pastor can go back there and talk to her. And it was just a strong stigma. You didn't let your secrets out the house. past the door.
Anyone else have a different viewpoint or addition to that? Yes?
I must admit, I had to take a different tact because there were many terms that I couldn't start to figure out in this. So basically, I plotted the information that I could understand here in terms of the family situation. So I worked out, okay, the mother and the children are living at home. So I've done a kind of a different mapping.
Go ahead.
Because as I say, there were obviously things that people intuitively understood. And for me to even begin to think about names, if I didn't know that information, then I was just bringing my own bias or my own assumptions. So I felt better to stick with a more general, approach that I felt comfortable with, that I could engage in the conversation. So I just want to. Yeah.
Right.
So basically, you're saying you didn't have the cultural awareness to be able to identify what those things meant.
Many of us don't.
Yeah, I mean, I didn't understand
The
terms,
exactly, because those are cultural, sort of identified cultural terms. And so if you're not necessarily familiar with a particular culture, if somebody says, well, my mom belongs to Jack and Jill, that goes right over your head. You don't know what that implies. But if you are familiar with that culture and somebody says, my mom, my parents, my folks belong to Jack and Jill, and we go to their activities all the time, you know that family is one that's socially connected in the African American community, that kind of thing. So we're going to talk a lot more about cultural competence and cultural humility a little bit later, but that was sort of the point of that exercise, is kind of to show that we have to really be in tune with other cultures in order to be able to understand and infer what some of those things might mean. So what are some other things we got? We know about his education, or her education. We never really identified this person's sexual orientation or identity. I don't think we can. We said that we think he probably identifies as male.
Right.
So for now, we'll just say male. But education, what do we know about education? Pre-med at a prestigious university. On a full scholarship. Academic scholarship.
Not sports, academic. Right.
Very good.
And so with that, though, what do we know about the pressures of college students who come on a full ride to a university? What do we know about those pressures that come in?
The crushing. Absolutely crushing. He cannot fail. Everybody in his community and his family in this scenario is heaping pressure on him to be that thing that we all
Can we,
aspire for our children.
I'm sorry, can we ask you to turn the mic towards you?
We can try. I don't have to reach over there.
And I'm going to relate that back to the other day. We saw The Rock, a person, The Rock. What are the crushing things in that rock, right?
He certainly has overwhelming academic and familial pressure to succeed, which is a big crusher as it is. But on top of that, he's got family distress and family strife and family secrets and family division. And on top of that, he's got his father's health. On top of that, he has coming out. This person is set up to fail in every one of several areas, and then they're all happening together at the same time.
Right.
And I would dare say this is not atypical of many in this age group. Maybe not all of these same barriers at one time, but certainly many of them. And I think many of our college-age, college-bound, or even those who are not, are faced with some of these same issues staring at them. For instance, he's probably worried about what he's going to do as far as getting into medical school, post-college, what his career is going to be like, and can he accomplish his goals and also take care of his family? And can he accomplish his goals and also be dealing with his LGBTQ issues? I think that these are not unusual for us to encounter among this age group. And I think that was one of the reasons why Mitt wanted to put together this sort of scenario.
So we do know that 18 to 21 is the pressure points for that age group as it relates to mental health, right? And we do know that going off to school, and I want you to think about, outside of Person X, all the other persons that do not necessarily go off to college. But we do know that high school graduation brings a pressure that rock is on that young adult to be able to succeed. And if you think about the success as it relates to those social organizations, Jack and Jill socializes you to go off and do great things in the world. So not only does he have the pressure of his whole family system, it's all of the groups and the friends that he made within Jack and Jill. And the boule, as we know, also, what is your son doing? You know, Dad, what is this about? So again, it's not only the pressure that's internally, it's the external pressures. And all of a sudden, and I kind of read this with Dad, Dad was probably successful being in the boule. They don't invite everybody in. So probably the good thing about that is he has supports, right? If they can get out of the family secrets. And even, is it a secret within even all of those organizations? Or is the pressure to come to my professor and say, my dad is struggling with kidney disease and I need to take care of them? And at some of our institutions, when a person is absent over and over, but is doing really, really well, and then all of a sudden, you don't have the professor who reaches out, because some of our institutions believe that it's okay to fail. That in fact, if you don't succeed, maybe it's just not your time yet, right? And then you have a completely different philosophy, not saying one is better than the other, but the HBCU philosophy is look to your left, look to your right, and make sure that person's there. And so I might be able to better go tell a person, look, this is what my dad has, right? I can't make it to class all the time. What can I do? So it is important to understand the person who stands at the top of this table in a classroom really dictates not only the success, but the relief valves of students that they see in their classroom. And what they do with that information is critical. Are you of the belief that well, you know, maybe it is just not your time to be in the program? Yes.
I just wanted to add, and when you talk, I'm beginning to realize that in the African American community, you have many of the women are caregivers, and so it's beginning to be a little strange that if it's a male taking on this caregiver role, it's usually flipped, where the women are always the caregiver and not the men. So this may be a woman, maybe on the gender side, but also when it comes to taking care of the family, regardless of what age you are, the women always take on the caregiver role.
Right, and we don't know if that was a family of all men,
right,
or if it was the heart of an individual.
Right.
You know, parents often say to their children, never put me in a nursing home.
Right.
So what rules were set at home as you were raising your children? I don't want to go in a nursing home, and wow, Dad did this for me, so I'm going to just go ahead and do that. So there's a lot of pressures there, which we have to say, Julian, it's the mapping part of it is really, I'm really glad that you said that, how you map that. But what are the clues that you have? That this rock, you can see why suicide is in that person's head. You know, it's just a lot of responsibilities between 18 to 21. Family, mother is saying, we don't know what the dad did to get kicked out the house, right? We don't know what the dad did to get kicked out. And because that is even something that we have to really kind of think about. So there's a lot of family crisis going on. It obviously seemed to present as a family that was moving along in our society in the middle to the upper social economic group. And then all of a sudden, dad's out. All of a sudden, dad's sick. Does dad tell his own family secret or his medical secret of, I need kid, I need to get back, because he had peritonitis. So to me, it was kind of thinking that maybe he was trying to do that at home rather than to go to a facility, right? Perhaps, I don't know. But with that happening, now I have to go and publicly sit while I go through dialysis. So what is all of the sham within the father's mind as well? Could that have been the way the family was raised, right? And so let's just kind of talk a moment, a little bit about family secrets, but more so about how we can identify, as I identified table 6 as being my rebel table. But when we get those clues, what do we do with them? What do we naturally do? When I know that a student, I know they should be succeeding. I know they had a 4.07 when they first came in here. I know that they've answered all my questions in class. I know that they're going to be a great doctor. And then all of a sudden, things start going down. What's the responsibility of the educator? Is there one?
Well, I would suggest that
Mike, please.
sit on the
Microphone.
information that we have. We want to learn more, so we can start to ask some more questions. I saw the clues and didn't know what they meant, so I tried to cheat and receive a consult. But Lonette was very stuck to the rules and wouldn't tell me. But so I think we have a responsibility to sort of ask ourselves why, and then see if we can use the clues to help fill in some of the information that we don't have yet.
Other.
This keeps coming for me, so I need to say it. I think we also need to keep in mind, we're concentrating a lot on the struggles. We need to keep in mind the strength of this young man or young woman. We're not 100% certain. He got where he got for a reason. He's highly intelligent, clearly, or he wouldn't have accomplished all of this. He clearly has parents who are very motivated, intelligent, and a community. On top of that, under extraordinary circumstances, he chose to come out to his family. He could have chosen not to do that. There's something there. And I just want to make sure we don't forget that this young man or young woman also has great strengths.
So we're looking at non-deficit thinking versus deficit thinking, and we're looking at the strengths perspective of, again, going back to Julian's plotting, to really begin to look at, wow, look at what one has achieved, to be able to bring it. Excellent point.
I think also the social support issue is huge, because this person on paper has quite a bit of support. But if you really drill down, it's not support that they're accessing. So from a asset perspective, one could try to help person X tap into those supports and maybe strengthen or build some more, I don't like to say this, but for lack of a better term, build some more resilience around that foundation that he or she already has. But I think it could be easy to miss the fact that person X is not utilizing the support that they appear to already have. You could just take it at face value and say they've got plenty of support. But the question is one of access.
And that brings up a point that I struggle with as the educator is, given that, how can I earn this person's trust if they don't feel safe with all the supports that they already have? What's going to make them feel safe or build trust in working with us to make it better? How do we do that?
I would always say that the support is the we, right? It's not so much us versus our students, it's the we, right? And how do we get our students to feel comfortable? Not that you want to, and I always would tell my faculty, we don't need therapy in the classroom, right? But if you begin to look at some of the things that are occurring in our world with technology, we no longer have really office hours, right? Where a student can come or you can ask someone to come. Things tend to be done through technology, right?
So, and just building on the strengths-based approach, I think as an educator, potentially saying something to the effect, I noticed that you've been doing really well in class and suddenly there's a change. I just want to check in with you and see what's happening, what's going on, which actually may potentially be enough for that person to open up. It may not, but I think just approaching someone with an observation and acknowledging their inherent strength and that something is different may open that door.
And I think also putting the human factor back into it, because even though we are educators, we're still human, and all of us have a breaking point at some point. And when someone comes along and they see that you're having a problem, even if you tell them, how you doing, how can I help you today, that's more than, moving, the world off their shoulders, even if it's just for today. I think we have to put the humanality back into it.
So human behavior in the social environment is critical to what we do.
Exactly.
And just building on that point, this person is incredibly loyal, because ultimately it's a conflict of loyalties between the mother and the children that stay at home. The father is lifting somewhere else, and then the community. I mean, he hasn't run away, or the person hasn't run away. He's stayed with everyone, so he's got grit. He's got determination. The person's got grit and determination. So there's, the loyalty builds empathy that we can build on. But I mean, it's an incredibly loyal person to a number of different.
I'm smiling because you came across the concept. What happens if at age 20 I find my mother and father separated? Right? What happens to my family image of my own family? I mean, that really becomes a factor, and it's again that rock where it takes me under a little bit because of the vision that I have of my mom and dad, and now all of a sudden my dad is kicked out the house, and now I'm taking care of my dad, and then the image that we have of children having to become the sandwich generation. You hear that all the time when all of a sudden it really is not a neat sandwich when you have to take care of your parents as well as continue to do the things that you need to do. So also comes a lot of clues, and I often ask people to look at intersectionality a lot more sometimes than the skin color, because when we all go through these things, that's the commonality that we have. Oh my goodness, this kid's mother and father, they're gone, and now he's not only he's trying to be the dad for the entire family system. Your mother's angry, other kids aren't taking care of dad. That's a message right there within itself. So you're right. When you begin to kind of look at race, gender, class, sometimes we focus on that and we miss the opportunities of what happens when a kid learns that his dad and his mom have separated at age 19 and 20. What happens when you get an academic scholarship? What is the pressure that it brings to bear on an individual to be successful? What happens when one comes out and they tell their family, they don't tell anybody else? Could that be the reason why they wanted to continue to join the Qs, right? Qs is Omega Psi Phi. It's an organization, a fraternity, an African-American fraternity for men. Is that going to give me my manhood? Right, where I can keep my family mask on to the boule or the kids that I grew up in Jack and Jill. All of that detracts from one's educational success. And I think what Steph and I wanted to kind of you all to think about is every young adult, no matter their race, comes with a myriad of issues to the classroom. And their success depends on how well they can navigate and use that strengths perspective to be able to say, I'm just like everybody else, and move forward. But the expectations that one has of the person who stands in front of the classroom sometimes is not seen as open, or I have to hide it from them of what's going on. All of these myths that we might have, some of them are real, some of them are not real.
Can I add one, just to get back to the question of how can I build trust? I think, again, we'll talk about culture a little bit later, but there are very specific cultural ways that different groups communicate and build trust. So, for instance, you just reminded me of a story with my son. He wrestles for Stanford, and he's had trouble because it's a predominantly white team. He's one of probably 2 or 3 African Americans on the team, but he's had real trouble connecting with coaches. And he's had some real deep, dark moments that the coaches have known nothing about. And these are the people, the adults that you have entrusted, with your kids. And so in conversations with the coaches, it just baffled me how they didn't know this is the person they see for multiple hours a day, every single day of the week, pretty much, and even travel with. How do you not know that this person is struggling? So after we spoke, it became clear that there were some cultural things that they just missed. For instance, an African American male is not likely to come to you and say, I'm struggling. My husband has a phrase, build relationships before you need them. And really, in our community, in the Black community, as a generalization, we really prefer relationships. I mean, we're very relational people, and we won't really spill the beans without that. I think that's true across the board, but for us, it's really, really important. You won't find out much personal information if you aren't a trusted entity. And so I guess the point of the story is you have to know culturally how to connect with people. And everybody is different. There are some things that are just, general across the board, but there's some things that are very important to different cultures. So I think that when you're in a position of authority, you have to be very intentional about building these relationships at whatever level is relevant and adequate. But doing that before you actually have to come to somebody and say, hey, I noticed, your performance slipping a little bit. Because for different people, that could be received, and for other people, that could be, hey, back up, you don't know me like that. So I think in advance of those type of conversations, you just have to try hard to build the relationship and do it in a way that's culturally appropriate.
I'm going to run through a couple of slides because Patricia had us really want to focus on one thing that we want to ask you as it relates to policy. But we wanted to show you this slide here because what we learn generally in the classroom or what we put, the readings and the literature that we put, is generally more towards the center. We learn more about individuals, white men. We learn more about people who we don't learn that much about, atheists, right? We learn all of those common factors. So when someone comes to our classroom who is different than us, even when you get your course syllabi or syllabus, you see that the readings are not there, the affiliations or what groups do you belong to are different. We begin to feel like a duck out of water, like I don't know what all that stuff means. And all it takes is an open-ended question with, tell me what Jack and Jill is all about and how it has impacted your life, right? So we always want to look at the outer part of the circle and learn from the outside in rather than the inside out. My students would always say, I want to work with kids. And I always would say to them, you want to work with kids because you think that's safe. You were a kid, so you have, I can do this. But when you work with older adults, it's strange to you. And a lot of times I would say to my students, like, tell me an older adult. What about your grandmother? Oh, she's not an older adult. Well, how old is she? Oh, she's 89, but she's not an older adult. I learned that often they talked about frail elderly. That's the population they didn't want to work with, but older adults who were no, my grandmother, but I can't deal with frail elderly. And so the younger people are, the more that they master the inside of that circle. And so that's just something that we want to keep up there. I'm going to we kind of went over this, but I also want to talk a little bit about our implicit biases. And we all have them. If we look at things that we learn, stereotypes are something. I remember watching I Love Lucy, redhead women, they had a hot temper. So anytime I would see a redheaded woman, I was ready for them, right? Because I learned that redheaded women have a hot temper. And so how do you get into understanding your own biases? And that's critical when you're working with people. is to understand all of us have biases. And we can either take those biases and make major decisions, or we can take those biases and say, how did I get that in the first place? And begin to dissect them so that we learn more about, wow, biases, stereotypes, but I'm not going to get into really kind of holding people back based on my own biases. And often that happens. The question that I'm racing to get to is for you to kind of understand the cultural competence. I kind of divorce cultural competence because people really can't know everything about everybody's culture. And, you know, when we first started moving into the language of cultural competence, people would bring different food, and we'd have these cultural awareness days, and people would say, oh, wow. And then, you know, one day I heard someone who said for a Latino person, oh, wow, you want beans and rice and this. And I'm like, oh, my God, we're getting it all mixed up. Cultural humility is to be able to say, I don't understand a lot about your culture. And can you help me learn more? And I also want you to kind of understand that culture is not where we put everybody in the box. And, you know, we had this about the Caribbean. Just because a person's skin is black does not necessarily mean they're African American. And just because a person's skin is white does not make sure that they are Caucasian. I always would do that with my white Afrikaners. When I would go to South Africa, and I would always say to my students, well, who is this person? Oh, wow. And it would be a white Afrikaner. You know, so we have to learn that the difference between race and ethnicity, we mix those words up constantly. And so how do we know that? Is a very simple thing I use is tell me your country of origin. Because that helps me understand the person from their country of origin, rather than for me just to look at the color of one's skin and begin to categorize them. Because we just really can't do. Our world is so diverse, and the strengths perspective is to build on that rather than to resist that. So Patricia wanted us to get to this question right here. And when she wanted you all to think about, knowing all of this, what are the policies that we can do to make sure that we are addressing this? And here's what came out in my local paper, the Philadelphia Inquirer. Pushback to cuts in college services. That universities are really cutting out in undergrad all the mental health services. They would rather refer than to have a mental health counseling center at the university. Yet we do know 18 and 19 is one of the most difficult areas to one's mental health. What are we going to do about that? This is becoming a national agenda. And in the article it reads that although the universities are saying how much it costs, they still are spending money on buildings. They still are spending money on their sports. And they know that the universities are becoming dangerous places because mental health is not being addressed. This room has a lot of power if we work collectively. So as we look at this question, and Patricia wants us all, we're all going to come back and we're all going to talk about what can we do to bring change to the status quo? So if you just spend a minute talking about it at your tables, and then we'll have you list some things.